Of course, we know about the WHO, we know its unaccountable nature, the Director General appointed through an opaque, non-democratic process, too much power for international pharmaceutical companies. And these regulations propose the creation of a vast public health surveillance mechanism at public expense, but also, if the WHO itself has anything to go by, it would be substantially funded by the pharmaceutical industry. And crucially, as my friend from Don Valley just mentioned, it proposes that the existing powers for the WHO to make recommendations about what countries should do should be upgraded from non-binding to binding recommendations. So it amounts to a vast transfer of power to the WHO. And what would these new regulations enable? Legally binding obligations on countries to mandate financial contributions to fund pandemic response activities. It could require the surrender of intellectual property and technologies. It could mandate the manufacture and international sharing of vaccines. It could override national safety approval processes for vaccines, gene-based therapies, medical devices and diagnostics. The powers for the WHO extend potentially to ordering border closures on countries, travel restrictions, tracing of contacts, refusal of entry, forced quarantining, medical examinations, including requirements for proof of vaccination, and even the forced medication of individuals. And it's not just when there is indeed a pandemic already declared that these powers might be invoked. It's when there is simply the potential for such an emergency that the WHO claims this power.